All right, I'm going to demonstrate the urinary catheterization on a female. First thing I'm going to do before I even get started is take a wipe and wipe off my overbed table. It's not going to make it sterile, but it will just keep it, make sure my surface is clean to start with. Alrighty. Good morning, Mrs. Jones. How are you this morning? Good. I'm glad to hear that. I am going to be inserting a urinary catheter for you, hopefully to help you pee better. Apparently you're having problems voiding on your own. So the first thing I'm going to do is check, are you allergic to latex or iodine? No, so good, very good. So first thing I'm going to do, I've provided privacy, so nobody's coming in. I've got the door shut as well to your room. And I'm going to raise the bed up here so I can work on you without having to bend over, maybe. I just want to make sure the bed is at a good height for me as I am preparing to do this skill, because of just, it's a challenging skill as it is without having to be bending over. All right, so the first thing I would do is perform pericare, perineal care, wash her up with soap and water. If she was up to the bathroom, I would have her shower and wash the perineal area first. So the next thing I'm going to do is go ahead and get her in a position that works for me. I like to make as much space between the legs as I can because this is where I'm going to set up my sterile field. I don't have a leg strap to secure my Foley with, so I'm going to improvise and show you a trick. But I will take two pieces of tape about the same length and put them to the side. Of course, I've done my hand hygiene coming into the room. And I'm going to lower her head down a little bit, make her a little flatter. Is that okay, Mrs. Jones? I think that's what I called you. Alrighty. So the first thing I need to do is find a good position for my table, which is probably about here, and I want it still just about waist height. And I am going to go ahead and set up my sterile field. Now I have a Foley catheterization tray that has a 100% silicone catheter and vinyl gloves, so they should be latex free. Alrighty, so one end of the bag actually has a perforation so you can make a neat, clean opening and take out my contents. Instead of using the trash can on the floor here, I am going to take my bag that my kit came in and make a kind of a garbage that I'm going to have up here. And I put it up to the, yeah, that will work, up towards the head of the patient's bed. Don't need that. So remember our sterile field concepts. First thing I'm going to do is open up my package away from me. I'll open up my flap. I'm going to open up this flap. So my challenge is this paper is going to flip back, so I'm going to kind of come around here, around the edges, not across, to open this up. And then I'm going to grab this top piece, once again holding my corners. I did grab the outside so that won't bounce back. And my corners, there we go. Okay, in your kit, The first thing that's on top is my sterile gloves, so I'm going to get those off without contaminating anything underneath it. Take them out, and I'm going to put them on. So I come down to the edge of my table, so I'm nowhere near my field. So as I open up my glove package, I am not contaminating my sterile field. Alrighty, I'm gonna put my glove on. My other glove. And then I just leave this wrapper here, step away from my field, from my table, and pull on that glove. Okay, next thing in my kit is my drape. So if you look at the drape closely, you can see that one side is shiny, that's the underneath side, and one side is matte. So when I pick this up, I want to pick it up in such a way that the shiny side is facing me. If my edges stick, I'm going to rotate until I get everything opened up. Okay, and then I am on the shiny side of my drape. My hands are behind me, not across my sterile drape. And then I get one stab at this where I'm going to bring this down and basically drop it between my patient's legs. If you have someone help you, they could reach under the leg and kind of secure that. So my drape is in place. Mrs. Jones, try not to move. I'm going to get my things together and then we'll get you started. This is the fenestrated drape. It's got a hole in the middle when you open it up. I don't use that. I'm just dropping it to the side. Oh, this one has Betadine. So the first thing I'm going to do is make sure I've touched everything in this kit. So I have, well, this one actually has the lubricant for the male lubrication. I've got my sterile water. This is for my balloon. And then I've got my iodine sticks. So let's see what we've got in here. These are really iodine or not. Okay. When I'm using sticks, I want to make sure that I have them loose and ready to go. Otherwise, you get them stuck in the package. And my gloves are sterile, my field is sterile, all my contents are sterile, so I can touch everything. So actually, I'm going to take these out. I want to make sure I touch everything in my kit before I move to my patient, because once I touch my patient, then I'm only have one hand to work with. So I'm going to carefully remove the sheath from my catheter. Actually, this one's a little bit different. Interesting. So this one actually has a tissue tear. Let's see what happens with this. This kit is different than what you will find in your kit. Ooh, gotta watch the floppy catheter. There's probably a better way to do this, but got it off. Just gonna drop that to the side. Make sure you're dropping and not placing things in the garbage. In this case, my lubricant is in my syringe, which is great for the male because we would inject it directly into the urethra. But in this case, I'm going to lubricate my tray. Done with that, and I'm going to actually lubricate my catheter because I'm doing a female. And I'll set that there. The other thing I'm going to do before I get started is actually connect my sterile water, which has 10 milliliters in it, to my balloon port. And that is ready to go as well. So once I've done that, everything is ready to go. Bring my tray over to my sterile field I've set up here. And then this is the challenging part. I'm going to look for my urinary meatus. So I really need to hold my labia apart. This rubber mannequin's a little tough. Once I've done that, I'm going to come down one side and then I'm going to ditch to the garbage. I'm going to come down the other side of the labia into my bag, and then I'm going to come down the center. Garbage. This hand, left hand, is contaminated. Right hand is sterile. Next thing I'm going to do is bring my whole box over. I've got my lubricated catheter, and I've got it about 2 to 3 inches. Grab a hold of it. Careful, I'm not going to hit the leg over here. And I'm going to insert it. I have urine, and then I will insert it 2 more inches, 2 to 3. Once I've got it inserted, then I grab a hold of it with my contaminated hand, because I've inserted it as far as I want it to go. And then I will inflate my balloon. If I let go of it with my left hand, my contaminated hand, and the patient sneezes, coughs, bears down, that catheter will slide right out, and you will be putting it back in. So once I've got my balloon inflated, then I will separate that, and then I pull back until I feel the balloon hit the inside of my bladder. And I will take my bag and I will position it on my bed, not on a bed rail, not on any moving part of the bed, but just in a different area, which is down here somewhere. There we go. And I'm going to clean up my patient a little bit, but the other thing that's really important is to, out of the way, actually secure my catheter. I'm going to take my tape, put it on the inner thigh, or if you had a leg strap, then you're going to secure it using that. And I'm going to take my other piece of tape, come around, have my 2 pieces edges meet like that, where it's taped together in the center, and then I will put this over my other piece of tape, maybe. Such as this. When you do it like that, that really does keeps the catheter from being pulled on. You want slack here so that you're not irritating the urethra. Then I'll clean up my workspace here. How you doing, Mrs. Jones? I think that went pretty well. Take my gloves off. Do my hand hygiene. And put my patient back in a safe position. And then of course the last thing that we do is document our procedure. I would document what French catheter, size catheter I inserted, how the patient tolerated the procedure, how much urine drained, and I think that's everything. And then of course monitoring the urine output after that procedure is done. I think that's it.